Remember, if your active movement is restricted, we want also look at the passive range of motion. Yeah, like what we do in the knee. We look at the active knee flexion, but also looking if it's also passive restricted. So if active and passive is restricted, then you think it's more joint, isn't restriction. But if active is restricted but passive is full, maybe it's just a muscle guarding, preventing that movement. So we kind of want to do those tests to establish movement impairment, comparing level above and comparing level below. Okay? So, please, if you could lie down, face me. So that's what I'm going to do. I'm going to flex the patient's hips and I'm going to feel the opening or separation between the spinous processes. Okay? Separation between the spinous processes. Or if extension is painful or limited, then I can go into extension, feeling approximation of the spinous processes, yeah? Comparing level above and level below. All right, so keep it. No, it's okay. So come towards me a bit more, just towards me. Perfect. All right, so I'm just gonna, so that's okay. So the way, so normally we start sort of with the knee slightly flexed. Now, if you look at the iliac crest, from the top of the iliac crest here is going to be L4, L5 level, isn't it? So now what I'm going to do, I'm going to place patient's legs on my thigh, even more a bit closer, just a little bit more, perfect. So I support the patient's legs, and what I'm going to do with my legs and body, I go into hip flexion that will induce lumbar flexion, isn't it? So I'm feeling for that separation or segmental mobility. Okay. Go to the next level. Okay. So does anyone want to feel? Do you want to feel? Feel a little bit. Just place your fingers here. Just very. And the less you put pressure, the easier to feel. So what do you feel of this? Yeah, moving. Yeah, it's moving, it's opening up. Yeah. So basically you feel that almost separation between those two spinous processes. If you do not feel it at some level, might be that the segment is hypomobile. So it's not moving or separating, so you're not getting that stretching effect between the levels. Now, if some people are very flexible, you may need to flex the hips more before you feel the lumbar moving. So depending, if you've got more stiffer hips, the movements in the lumbar will start a bit earlier. You know what I mean? So, and you see, I'm not holding the legs like this. I'm just placing under the tibia. And then I can even use no hands to feel the movement. See, so I'm attached my thigh on the patient's tibia. So I can create that segmental movement. Okay, so that would be flexion between the levels. All right, now for extension, I get you to bring your shoulders back a bit, so it's more, you almost line obliquely a little bit more. So you're not rotate, just bring your shoulders back a bit more, just here. Yeah, but not rotation, just like with the body, like that, yes, good. And here, that's perfect. Okay, so when you do extension, so the patient lies a bit more obliquely, okay? Now what I'm gonna do, I'm gonna flex the patient's knees, which puts the tension on rectus femoris. And in that way, when I come over on top of it, I place my hand under the bottom leg, like on the tibia, and I slide the legs back. Can you see that? I slide the legs back, creating lumbar extension and feeling for that approximation of the spinal levels, okay? Feeling for that approximation, segmental mobility, okay? Looking, is that stiff or the joints are moving fine? Compare the level above and below. But you see, so yeah, so maintaining this flexion, and then just getting that, pushing, so I'm not really lifting, I'm pushing back to get that extension, okay? So that would be extension. Now for side flexion, I get you just bring you come close a bit more again. That's good. And then slightly bend your knees. Beautiful. But keep your legs on the bed. Okay, like this. Perfect. Now for side bending, guys, I'm going to use my hand and the greater trochanter through the greater trochanter to create side bending. So in the spine, what I do, again, my index finger between spinous processes and a bit below. And I'm feeling kind of opening up at the bottom and closing at the top with side bending. Yeah, the spine is very rigid, it's very stiff. So you can't create any side flexion. But yeah, so when I do this, approximation from the top and stretching at the bottom. Okay? Which side is up? Look, it depends if a patient, whatever the patient can tolerate. Some people cannot lie on the right, so you can do the same test lying the patient on the left. Okay? So I come on top, this hand is just on the greater trochanter. Okay, so final 4-5, and then I see what I'm doing. I'm just not creating any tension, just movement. So it's a movement test. Okay, so in between my index finger and underneath. Feeling closing and separation between the spinous processes. And she's got lovely movement, so she definitely doesn't have movement impairment. Okay. And you can see I'm not creating any force, it's about movement. Think about movement. You know, when I says elbow flexion or end range extension, so it's the same thing, but in the spine. Looking at segmental mobility. So just come a bit more on top, neutral spine, and then you create that side flexion. Okay? Creating that side flexion. Comparing level above and below. Any guys questions on this? So for flexion, remember, just get the legs and place them on your thighs, so we're not holding it. So then using your legs to create lumbar flexion, much easier, rather than, you know, sometimes I see people holding the legs, too difficult. Just try to a bit more, so it's more comfortable for you. Now, certainly, if you're a small therapist and you've got a very big patient, might be a bit difficult to do this test. And that's okay. If you cannot do it, we'll show you some alternative things. Maybe for practice purposes, maybe try to find a similar height, maybe similar weight, because we're still learning a bit. So don't, you know, try to get the highest person and you're the shortest person. Okay? Let's try.